inspect for color, hair distribution, and lesions or ulcers in your lower extremities. So, okay, I'm checking for, I'm looking for lesions or any unusual condition. Okay. Okay. Then I'm going to inspect and palpate for lesions or edema. So, okay. Okay. The next is you're going to palpate bilaterally for temperature of the feet and the legs. So you're going to note the location of any changes in temperature of the toes, feet, and legs if they are equally warm bilaterally. So I'm going to check the temperature of your feet, sir. Okay. Next is you're going to palpate the superior, the superficial inguinal lymph nodes, and you're going to note for any tenderness or even 1 or even 2 centimeters are commonly palpated. So karon sir, I'm going to palpate your inguinal, sir. Okay. I'm going to check it. I'm going to palpate it bilaterally. Okay. Next is you're going to palpate for the femoral pulses. So ask patient to bend the knees and move it out of to the side. So femoral pulses are strong and equal bilaterally are the normal findings. So karon sir, I want you to bend your knee sir. So ato lang i-bend sir, kani dili na lang sa pikas sir, kani sa right side nimo. Then i-move na to sa side. Yan na. I'm going to check for a femoral pulse. Okay. Then next is you're going to auscultate for the uh, femoral pulses. So if arterial occlusion is suspected in the femoral pulse, position the stethoscope over the femoral artery and listen for bruits. So it is to detect sounds. So karon sir, I'm going to auscultate your femoral pulses sir. Okay. Okay. The next is you're going to palpate the popliteal pulses. So you're going to ask the patient to raise the knee partially or flex the knee partially and place your thumbs on the knee while positioning your fingers deep in the knee in the bend of the knee. So it is unusual for the patient, for the popliteal pulse. It is not unusual for the popliteal pulse to be difficult or impossible to detect and yet for circulation to be normal. So, karon sir, I'm going to, I want you to bend your knees, sir. Yun na po, sir. Bend na tatong knees. Then, I'm going to palpate for, popliteal pulse. Okay. Next is you're going to palpate for the dorsalis pedis pulses. So dorsiflex the client's foot and apply light pressure lateral to and along the side of the exterior tendon of the big toe. So you're going to assess the amplitude bilaterally. So now sir, I'm going to palpate your dorsalis pedis pulses. So I'm noting for the heart rate, the pulse rate, the rhythm, and so the rhythm is symmetric and the strength is normal. So next is you're going to palpate the posterior tibial pulses. So palpate behind and just below the medial malleolus. The malleolus. So karon sir, I'm going to palpate your your posterior tibial pulses. Okay. Next is you're going to inspect for varicosities and thrombophlebitis, so you're going to ask the patient to stand because varicose veins may not be visible when the patient is in supine and sitting position. So as the client is standing, inspect for superficial vein thrombophlebitis. To fully assess for a suspected phlebitis, lightly palpate for tenderness. Then if superficial vein thrombophlebitis is present, not redness or discoloration on the skin surface over the vein, then the veins are flat and barely seen under the surface of the skin, then those are normal findings. So now, sir, I want you to stand, sir. Maindog sa ka, sir, ha? Maindog sa, sir. Then face here. So I'm going to check for any varicose. Okay, thank you, sir. Ikot na, sir. Then moving on to the assessing the arterial insufficiency. So first is you're going to perform position change test. So in performing the position change test, I'm going to have my patient lay down in a supine position. So balik na po to, sir. I want you to lay down again, sir. So now, sir, I want you to close your eyes, sir. Then, if I want you to say flex, if your legs are flexed, then I want you to say extended if it's extended. Okay, kung moingon ko kan, sir, moingon ko kanang naka-extend ang imong, kung ako i-extend ang imong tail, sir, imo i-identify naka-extend siya, okay? Kung naka-flex lang, yun po kag-flex. So, ang pasabot sa flexor, nga gamay lang nga movement, sir, ha, sa imong legs o sa imong knees. Tapos, ang extended, kay kanang sobraan na gid nga, ako na siyang gi-move gid siya. Extend, okay? Flex or extended?
Like,
Kana, sir.
extended.
Okay.